I was in agony. Well, that was your fault, not mine. There is zero chance you can have a 1 to 2 day delayed response in pain, not soreness. Soreness can kick in a day later, but pain can't. So don't ever get sucked into that. They try that on you all the time. Oh yeah, 3 days later, I was in agony and it's your fault. Probably not. Theoretically, maybe, but pain is always bad, and pain is, be very specific, that evening or the next day, okay? If they said I was in pain or sore, let's say, and usually they won't say I was in agony or pain. It happens, but usually they'll say, I was a little sore that night, next day. A little soreness, I like it. A lot of soreness, not. So I do an exercise on Dr. T. He comes back next day, says, yeah, that night I was a little sore. I'm like, perfect, that's good. Went away by this morning, right? Or no, it's still a little sore. Good, that means we nailed it, we did it perfectly. But since you're sore, I'm gonna back off today. I'm gonna drop it 20% in intensity and strength. Do it a little gentle, right? So the goal is to push them up to the point of soreness as hard as they can, never pain. You gotta say this like 8 times. They're slow, they don't get this. So no pain. Number 2 rule, hard as you can. The harder, the better. This stuff responds to stimulation. The only way to stimulate it is to stretch as hard as you can. So the number 1 rule is no pain. Number 2, as hard as you can. Never get them confused. They always, and this is exactly how I talk to the patient. Don't get them mixed up. I have 2 goals in my practice. Get good results for my patients. Make as much money as I can. Milk the insurance companies. I want to get paid. But I never get them confused. I never put money over good care. I never want to be paid for something where I didn't deliver value. Okay? And typically I try and do a 2-to-1 ratio. If I'm charging you $5,000 for stem cells, I'm doing $10,000 worth of quality care. That's typically what we do. Most chiropractors charge $2,400 to rehab a bulging disc, and they do a crappy job of it. I do twice as good a job for about 30% less money. That's our typical, and I'm okay with it. I'm the cheap guy. But not only am I the cheapest, I deliver way better. It's always a 2, and you guys, that's a general rule for life. If you want to make $100,000 a year, do $200,000 worth of work, and you'll make your $100,000 a year. See? But that's a general rule, but most employees don't want that. They go, I want to do $100,000 worth of work, and I want to make $100,000. And they struggle for most of their career, and they feel unappreciated and underappreciated. Go out there. You know, I taught my son this. He works for me, and he came in, and I said, you always take more and more responsibility. Just start volunteering. So he came in, and he started at the front desk. He was the peon, he ran errands, and he goes, I want to learn this. So people taught him, and he figured out how to run the front desk. He became one of our best front desk employees, and he's my son, so I'm totally biased. But he really was good at the job. And then he goes, hey, can I learn this? I watched him in billing do this. Can I learn this? And within 2 months, a bunch of the billing people were coming to him asking for questions, and he started just doing it. And I went to him and I go, hey, we're going to give you a raise. And he goes, nope, I don't want a raise. He turned down 2 times. He turned down raises. He said, nope, I'm just happy learning. I'm just happy learning. But he kept becoming more and more valuable. And I said, okay, okay. I offered him a 3rd time for a raise. He goes, Dad, wait until it really hurts, and then I'm going to take a cut. So that's his strategy. But he's always looking to do free things. So anyway, that's what we're trying to do. We're always trying to add value. So I don't know why I got rambling on that. But don't get them confused. Do it as they need to understand, and you have to keep pushing them. It needs to be to the point of pain. That edge is where all the results occur. Okay? The 3rd rule with exercise, actually these are the only 2 that really matter, is you want to steadily increase it, and you want to change things up. So I like to focus on 1 exercise, 3 sessions. But you don't move on to the next exercise until they're good at the first one. So if they refuse to the first one, I don't add to it. And I make sure they're good at it. So the key is you need to have same plus different. So if you show them one exercise and that's all they do for 8 weeks, you suck as a doctor. There's something wrong. So what it is here's an exercise. I picked a random exercise. And here's what you guys should understand about exercises too. They've done a bunch of research on exercises, and some are better than others. But the most famous exercises for the low back are called the McKenzie exercises. This guy McKenzie came up with a bunch of exercises, and he got good results with low back pain doing his exercises. Somebody comes along and goes, and they did an experiment. And they said, okay, we're gonna take 100 people, split them into 3 groups. This group, randomly, this group is gonna do the McKenzie exercises with instruction. They're gonna do them perfectly. This group is gonna do no exercises at all. And this group is gonna do the exact opposite of the McKenzie exercises. If he says twist and bend this way, they twist and bend the opposite way. Okay, they tried to come up with the opposite exercises. Guess which group had the best results?
The original Mackenzies?
Yep, they got the best results. Guess which group had the worst results?
Opposite.
The nothing?
No, the group that did nothing. The nothing group had they had no results. The McKenzie group improved. Now what about the group that did the opposite? They had 95% of the results of the McKenzie group. They were almost as good. The rule is, it doesn't matter what you're doing, it's all yanking on scar tissue. And what really matters is, are you doing it as hard as you can, consistently? So it's consistency. How often should people do their stretching exercises? Twice a day. The more the better. As long as they're pushing up to that point of slight soreness, that's all that matters. If they're not getting slightly sore, they're probably not doing it right. But I'd rather them be a little sore or not sore at all than too sore. Too sore is super, super, super bad. You're actually encouraging scar tissue growth, and it's pro-inflammatory, and we don't want to do that. Make sense? Any questions about the exercises? So someone comes in, I start them on exercises immediately. I make it super, super easy. I'd rather err on the side of too easy than not. Super simple. Find a super simple, easy exercise. You always have a printout for them. You show them in the office, then you make them do it. Okay? So if you have bad shoulders, say, okay, you're gonna hang and rotate your shoulder like this. How far can you go? And then the next time they come in, show me. And then you say, now, then, and what I like to do is always add a little twist to it. Okay, so I showed you an exercise. You can't quite do it right. You know, it's challenging. And then I go, okay, now this time you're gonna try and go wider circles. Now you're gonna rotate it internally. As long as you're tweaking it a little bit, you look super knowledgeable. You look like a pro. Oh, and so I'm always going to, I walk around the traction room sometimes, there's 8 people in traction. I don't know any of them. I walk around the room and I go, hey, Elena, come over here. And see how her head is not perfectly straight? I'm gonna rotate it here, do it here. See if you can get, I look at her card so I look like I know what I'm doing. And then I go, I want more extension. I want her head further back. Now I do know what I'm doing, but the fact that I'm tweaking it slightly, and then I look at the patient and I go, hey, they're doing it exactly right, but if I can tweak it a little bit, I can get you slightly better results. So I'm tweaking it a little bit. Patients love it. And I genuinely care, and my credibility skyrockets. So all you have to do is go, whatever they're doing, say, oh, let me show you this one trick. I'm gonna make it a little bit more effective by doing it wider or holding it in this position. You see what I'm saying? So focus on one exercise for up to 2 weeks, but every 2 weeks, and you tweak it every time. You know, now you're gonna hold a weight. I'm gonna give you a 5-pound weight. Boom. Doesn't matter. You know, is it as hard as you can do it? Does that make sense? Mm-hmm. And then every 2 weeks I would add a new exercise or replace it. Now we're gonna do a more aggressive one. So you want them doing 2 to 3 exercises. By the end, they should have 4 or 5 exercises in their disposal. You're reviewing each one with them. This really only needs to take 5 minutes. This shouldn't be super time consuming. Mm-hmm. Also, do you want to do the laser before or after the exercises?
Usually do it after, but it doesn't sound like it matters if they have a 48-hour reaction really get after laser?
Typically, it doesn't super matter, but it does because hot ligaments and hot scar tissue is 30% stronger. 30% stronger. You heat up a ligament, if it's cold and you try and stretch it, it ruins the viscosity. You heat it up, it actually is 30 stronger. Its breaking point went up 30%. That's why stretching before an exercise, it's not the stretching that prevents injuries, it's the heat. And they've actually done research because they said everybody stretches before an event. Everybody universally knows you stretch before you exercise. So they did an experiment. They took a large group of people and they said no stretching, jog in place. Injury rates were both much better than the non-warm-up group that just goes out and does it.
I thought you were talking about before or after an injection.
Oh no, not at
Yeah,
all.
sorry.
That's your field. I don't know which is better.
All right.
You do it